It's 3 o'clock. Let's go ahead and start our Mason County Board of Health at the regular meeting, March 27th, 2018. We have some new faces that we'd like to go ahead and welcome, as well as just reintroducing ourselves. So, Doctor, why don't we start with you, and we'll go around the table. And
yeah, so hopefully I'm not new. Dr. Diana Yu, I'm Mason County Health Officer.
Gary Plews, I'm representing the County Fire Commissioners Association, but in my other life I was in public health for 35 years. So,
excellent.
In fact, I used to work for Thurston Mason Health District.
Excellent. You'll bring a good background of history and knowledge for us.
Yes.
We appreciate it. Thank you.
Carrie Davidson, Shelton School Board.
So what do you know about health?
So I grew up with a dad who was a pharmacist. I've got a whole family of pharmacists. My uncle was as well. My dad owned, and with my mom, the medicine shop pharmacy here in town. My husband is a pharmacist there now as a manager. And I've worked for Merck Pharmaceuticals for 14 years.
That's why your name is familiar. I talked to your husband the last couple of weeks.
Yes, yeah, I know I told him I was seeing you today, and he said he had some type of vaccine thing to do, so, yeah. Yes, a little bit of lived my life in healthcare.
Good.
As well. Very interested in public health and all
We
of that.
appreciate you joining us. Be a good asset. I'm Scott Hilburn, a commissioner at Mason General Hospital.
Kathy McDowell, City Commissioner.
Marie Drexler, Mason County Commissioner.
And I'm Peggy Van Lester, and I'm Commissioner for Hospital District 2, and also a pharmacist.
Good. Thank you, appreciate that. Next item on the agenda is the approval of the agenda. Have you had a chance to review it?
I make a motion to approve the agenda as presented.
Thank you.
I'll second.
All in favor of approving the agenda for the March 27th meeting, signify by saying aye.
Aye.
Motion is carried. Next, approval of minutes. Have you had an opportunity to? I have a question, I guess for Melissa. I didn't see Dr. Yu, who was at the meeting, on the list of attendees.
You weren't here last time, were you? Oh, you were.
Is that just an error, or is there a procedure?
Yeah.
Oh, okay.
I'm so
Yes,
short,
you
it's
were.
hard to see.
Yes, because you gave the report. It was the meeting before that that you were.
Yes, I was not here in January.
I can correct that and bring it back if you'd like, or.
I will just amend it to include Dr. Yu's attendance.
Thank you.
Any other corrections, additions to the minutes of our January 23rd meeting? Okay, is there a motion to approve it as amended with Dr. Yu's attendance noted?
I so moved.
Thank you, Peggy.
I'll second.
All in favor of approving the minutes of the January 23rd meeting, signify by saying aye.
Aye.
Motion is carried. Health officer report. Doctor?
Thank you. I think I'm going to start off very briefly with a report on how influenza is affecting our community. The total numbers are lower. Unfortunately, there's still a lot of activity with influenza, in particular influenza B. So there's still quite a bit of activity, and so we're not out of the woods yet with that. So that pretty much is our disease update. Today I have Abe is going to be doing the presentation, and I apologize for not getting the presentation to all of you ahead of time. It actually was a little bit more challenging to put all of the details together, and it still continues to be a work in progress, because as we reached out to the community of other folks who are doing syringe exchange, we continue to get information. As a matter of fact, we amended some of the information this morning. So And so what you will have in the presentation is as of late last week, I think. So, and I do have a little bit more information in paper copies of the budgets that other agencies have been using, if you're interested in looking at that, but I kept that separate. So I want to briefly actually introduce the team of folks that have been working on it. But actually, I'll let them introduce themselves. How's that? We'll start over here.
Abe Gardner, and I work on the opioid response plan.
I'm Christina Millershin. I also work with the opioid response plan.
Allison Smallwood, health educator.
Audrey O'Connor, public health nurse, and doing the overdose reporting.
Ben Johnson, I'm also helping out with this project. I also am the coordinator for the Substance Abuse Prevention Coalition.
Okay, I'm Debbie Riley, the Environmental Health Manager. My task has been to try and figure out how much it's going to cost us to bring in boxes, have them put in the ground, decaled appropriately, and it's turned into a bigger project than I thought it would. Also, the environmental health staff are working on a syringe pickup video for YouTube. And we've got the text written out. I've got the detergent bottle and a syringe on my desk. Everybody keeps coming in going, why do you have a syringe on your desk? So hopefully for the next board meeting, we'll be able to put that up on the screen to show it to you.
Great.
And I'm Lydia Buhite, the Mason County Community Family Health and Human Services Manager. And this is my lovely team, part of them. And they're doing an awesome job. So I'd like to work with them.
Everybody got one? Ben?
Oh, that screen's going to drive me crazy.
I know, it's cockeyed.
It's crooked. Much
Will
better.
all the OCDs please leave the room?
Present like this. I'm Abe Gardner. Work for public health, work on opioid response plan. And just want to reiterate that this really has been a team project. So there may be points or topics within this presentation that other team members may have some more input on. And if you have any questions or clarifications along the way, feel free to bring them on. So I want to start out SEP is a syringe exchange program. So the reasons that we've put together would be putting a value on these syringes. The exchange program we'd like to put together would be a one-for-one exchange. So somebody would have to bring a syringe to exchange it. Would prevent the spread of bloodborne pathogens. For those who don't know, in Scott County in Indiana, back in December of 2014, there were reported 3 cases of HIV. At the beginnings of March 2017, there were 215 plus cases of HIV that could be traced back to that particular strain. Amongst those 215 cases, 95% of those also were Hep C positive. So one of their solutions was to start a syringe exchange program. That a executive order was signed by now Vice President Mike Pence. At that point in time, he was governor of the state. It was that important of a problem to find a solution to. So right now, for our county, we're thinking it's an ideal time to hopefully prevent some of that from happening. trying to be proactive in our solutions. Access to clean syringes for folks. You'll see local is in all caps there. We want to be able to provide local resources for our county and community. Right now there's syringe exchange programs happening in our surrounding counties, but we're hoping to provide one here in Mason. The next slide will show you some outcomes, and one of those we're hoping to have it be an access point for folks that may not have access to certain health resources and other recovery services. The first outcome that we've pointed out here is improved communication between our local public health community and our injection drug using community. Right now, with the grant that we were awarded from the State Department of Health that Christine and I have worked on, that she's working on currently, we've been able to engage a lot of this community, we've been really successful in building trust. We're hoping that this is an opportunity to do that and take it even further. We're hoping that fewer syringes are found on the streets. We're not anticipating that a syringe exchange program would eradicate all of the syringes on the streets, but we're hoping that it'll alleviate some of that. And we're hoping that it'll impact the overdose death rate by providing education and naloxone along with our syringe exchange program. We're hoping that that can impact overdose as well. And of course, we want to be able to provide more information and community resources and referrals to drug treatment. Just this last week, we went down and met with Grace Harbor, and they've been doing their syringe exchange program for about 15 plus years. In the last 3.5 years, they've been partnering with Evergreen Treatment Center, where they come out and they have a representative there. They've been able to refer over 700 clients to treatment services directly from their syringe exchange program. So our ideal setup is to be able to provide some of those connections to recovery services. And of course, improved health. Less wound infection, less abscess, less transmission of HIV and Hep C.
Just so you know, Dave Wyndham is watching online. If you have any questions, ask him in Texas. Hi, Dave, whichever camera's on. So your boss is watching you.
Perfect.
Okay. No pressure.
So discarded syringes. As Debbie had mentioned earlier, we are putting together a bit of a campaign to try and educate our community on picking up discarded syringes. So we want to stress that regardless of what happens with the syringe exchange program, we know that this is a big issue. And as a health department, we want to empower our community to know how to pick up syringes in a safe manner and how to discard of them. We have Public Health Week coming up. We're going to put in the case kind of the visual of what that looks like, the utensils needed, as well as the YouTube video that we're hoping to then put up online on our Mason County website so people can access that. So we're hoping that the syringe exchange can play a part in that, but we also recognize it as a much bigger issue. And syringe collection boxes, I'll let Dr. Yu.
Actually, I'll have this was actually brought up at our last Board of Health meeting, the idea of having a collection box, which is similar to the prescription drug take-back boxes. So this is what I asked Debbie to actually look into. How do we get them? How much is it going to cost? Put one in the ground. So she's going to give us a little rundown on that.
Yes, indeed. Is it all right if I sit, or would you prefer I stand? I was able to talk to a few people in Thurston County, and they got me started in the right direction. Dr. Yu had a preference for a box out of several that we saw online, and the box itself is $925.50 plus sales tax and shipping. The company although I've tried 3 different routes short of ordering it, has not gotten back to me with shipping charges to Shelton, Washington. So we're guessing roughly $200 just to be on the safe side. There are plastic tote bins like the mail bins that fit right inside these boxes. They're $12.95 a piece. Recommendation is to have a couple so you can take one out, put one back in for each box. And time and materials to mount the box. I got the estimate from our good friend here at the county, Kelly Frazier. And he said $75 to $100 per box. That would include the labor and the concrete to set them, just like they did for the prescription drug take-back boxes. Logos and instructions were a little harder to nail down, not knowing for sure what we want them to say, but we're figuring a little on the high side, between $300 and $400 per box. That would include the creation and setup of the first logo, which the company would then have on hand for future new logos and wouldn't cost nearly as much. Another thing we did was checked with our public works folks, Bart Stepp out at Utilities, about having potentially a Connex container on site to put the Sharps containers, the returned syringes in, to be held for the time when they would all go to a regular disposal site, like the intermodal in Centralia, or transportation to Roosevelt and disposal charges at that site. And Bart said he was sure we could figure something out. He's more than willing to work with us. His primary concern was the safety of his employees, and we understand that and appreciate that. So, let's see, what else do I have? Thurston, oh, I'm sorry. Thurston County, I've got their waste hauler, Waste Connections, to paint their Connex container red and weld the extra opening shut so people couldn't get into it. And they actually used one of their old recycling containers. A brand new Connex container, a 10-footer, is just under $3,000, but we know we can beat that if we decide to do that. So that's the absolute highest. Thurston County's Needle Exchange Program has their Connex container emptied every 2 to 3 months, and their solid waste program bills them directly. Lewis County uses a 17-gallon container, and I didn't get how often that one's emptied or the particulars on that. So,
thank you, Debbie. So with the syringe collection boxes, it is basically meant to be parked somewhere for people to bring their syringes and dump it in there. That was one that it was of interest to the folks, to the board members the last time. I find special challenges with putting disposal boxes. Number one, we still have to deal with drug paraphernalia issues, people carrying boxes of or containers of syringes, transporting them to go to one location, put them in. Once they get into those boxes would have to be emptied on a fairly regular basis. So trying to figure out the staff, and then the contents would then have to be stored. So that's why the connection with the way Thurston County does their disposal of their syringes that they collect from their, not from disposal boxes, but from their syringe exchange program, they use this trailer in the transfer station. And that's where the used syringes are stored in a tamper-proof manner. And then once the container, it's a 10-foot container, I mean, it's a big container. Once it's full, then it goes to wherever it is that they end up disposing of it. So in addition to setting up these collection boxes, we would have to set up this other disposal component, which we will talk about.
You also run the risk of cross-contamination, somebody using it as a drop box for drugs, so then somebody would have to separate those out, reach in and get them outside of the needles, so they would use it for that purpose.
You mean
Drug
these,
take back.
these kind of boxes, yeah, yeah. And so they would, I mean, there's always that concern because currently the prescription drug take-back boxes, you get a lot of garbage in there too. And I don't know, I think you have the numbers of how much they pick up.
1,600 pounds last year.
Yeah. So, and with those, we actually, it's the sheriff is the one that takes them out, and then they dispose of it. They don't sort through it. They just take the whole thing. And we've actually talked about, you know, how much actual, you know, narcotics, opiates are actually being thrown in those boxes. It varies, you know, from place to place, and what people find in there. I have not actually looked at what we've collected here in Mason County. I know I did that in Thurston County when I was there. In Lacey, I stopped in and we went through one of the collections, and it was about 10% of what was collected was actually narcotics or controlled substances. They weren't all opiates. They were benzodiazepines, other controlled substances.
But it's still getting medications out of the water, so.
Yeah, so, I mean, people throw a lot of stuff in it, so.
I just worry about what it would look like to actually have to deal with that. You have employees. It's one thing we handle the needles, but you know that's what you're dealing with. You just take the container and get rid of it.
Yeah.
Pushing anything out.
And that's my point, so then all of a sudden you might have those other drugs in there, then how would that be handled? Because you're not gonna just drop that and send that over to
The landfill,
To the
right.
landfill.
So the prescription drug boxes, they don't sort through it, but it all gets incinerated.
yeah.
And this would not. So there is a difference. So we're presenting the information because that is what the board had asked for. So just as a per box cost, it's about $1,500 per unit, if that's what we wanted to do. And it's not something that I would recommend that we do. For all the same reasons. Well, because we also have to dispose of, if we can actually get syringe exchange going, and if we can get people to safely figure out how to dispose of their household syringes in a safe manner, which we are working on, you know, to start out next week for Public Health Week, to actually put it out in the media. This is how you do it, then there wouldn't be the need to do this. If people end up collecting syringes, you know, on the street, they pick up a syringe, they wouldn't need to go put in a disposal box. They can discard it in a manner that we're going to be instructing them on how to safely put it in the garbage.
And if we had set times, set locations, anybody wants to get rid of needles and don't want to exchange can still bring the needles or get rid of them.
Yeah, I mean, there are, they can certainly bring in, they can bring in syringes without getting any, if that's what they want to do. And some people have done that. I mean, you know, we don't necessarily, in Thurston, I know we took in more syringes than we gave out.
Doctor, we also have the police department, the Shelton PD here, and people often drop their syringes off to them.
And what do you do with them?
We dispose of them through the company that comes out. I wasn't
Stericycle.
prepared to give you the answer right
Yeah.
off the bat, but we have the red disposal
Yes.
boxes.
Stericycle.
It's not unusual for people, especially if they have, we find it most often, family members that were diabetic, they moved on or passed, or people go into a house and find these things in the house from some medical issue at the house previously. They come in hundreds. Sometimes they will come in and drop them at our front desk, and then we dispose of them through that proper channel. So we currently have a system in place in the city of Shelton that they can bring them to us, for disposal.
You can publicize that. No. So what is your, I mean, how much are you disposing?
It just goes up and down. It's one of those things that we may have a month where we get hundreds of these things coming in, because we also have community service that goes out and goes around town, and they use the same process. They collect them, bring them into us.
So just as an aside, Stericycle is the company that picks up the red container waste, and they usually provide 17-gallon big sharp containers. It's about the size of a big trash can. And for that, for less than 10 of those containers a month, they charge about $25. So Stericycle, that is their business. They take it and they do some kind of processing. They truck it all down to Lewis County and they process the needles and dispose of it through their...
QFC has a Stericycle pickup also.
Yeah. Yeah, so they do it by the container size is 17 gallons. And we will talk about that when we talk about the syringe exchange disposal costs, because it does make a big difference. Because it's, like I say, it's $25 per container, which if it's occasional, a couple of hundred syringes, it's not as big a deal as if you're running an exchange program where you're bringing in thousands.
Right, before we switch slides here, just want to touch on the paraphernalia issue. So we're also wanting to be mindful of safety for our law enforcement officers, you know, such things like pat downs. This might be, you know, probably going to be an issue we talk out further, but possibly working out a different policy where, you know, if officer finds himself in that situation, talking to individuals, letting them know that there's, you know, syringes on their person, and being able to dispose of those and not, you know, being charged. Go ahead.
Well, no, I mean, this was the issue that we had talked about with Commissioner Netherland before, where the big eye-opener for me was doing a drive-through with Abe, and his telling me, well, that's where people just toss their syringes out the window because they don't want to get caught with a syringe on them. So it's this whole issue of it's against the law for you to have a used syringe on you. Interestingly, in part of our research, we talked to the health department in Louisville, Kentucky, where they informed us about this policy that their law enforcement has, and it was a policy because it's a federal law, this drug paraphernalia law, but what their policy was that if a person was caught and they disclosed that they had a syringe on them, they would not get charged for having that syringe on them as an extra charge. I mean, they may be caught as a burglar. They would still be charged as a burglar or assault or whatever, but they wouldn't have that paraphernalia charge added to whatever it is that. So that was their solution, which made it safer for law enforcement. I do have a copy of that policy that I was going to share with our law enforcement to see if this is something that we want to do. And for me, it's primarily safety for law enforcement, because we have to deal with, you know, substantial exposure whenever an officer is doing a pat down, gets stuck with a needle, so unnecessary. And plus, you guys don't have room in the jail anyway. Right?
Don't start me down that road, Doc.
So it's, you know, just the needle itself, having a syringe on you, would it be safer for our law enforcement officers if we had a policy similar to that?
Just for information, you asked me to take that to Senator Cantwell, and we presented that to her, and haven't heard back if they're going to try and established
Yeah.
to change with that, but they took it seriously.
Yeah, and I think that this is a nationwide problem, you know, that is why we find syringes on the street, is people who are using injection drugs. You know, if you have legitimate reasons for using a needle, you won't be afraid of having it on you. But if you have an illegal use for those needles, you don't want it on you. So you just dispose of it.
That's a question of the chief. I'm sure your law enforcement community talks about this issue and this potential policy. What are you
Well,
hearing?
to
What
be
are your
honest with you,
thoughts?
I haven't talked about it outside of our agency. But I can tell you, it's pretty common practice. In fact, I venture to bet 90+% of officers will usually ask somebody, tell me what you've got on you. Do you have any knives, needles, otherwise, so I don't poke myself? And in today's world, it is not uncommon for the officers to say, I'm not going to charge you with this, if that's all you've got. Because it is. It's no different than as marijuana slowly became legalized, that people going, look, if you've got weed on you, tell me, I'm not going to take you to jail for a baggie this big. Similar to the needles. If that's all you've got on you is a needle, there's a good chance that you're not getting charged anyways. Where it becomes even more problematic, though, is, like you mentioned, that it would have to be worked out into there of, if I develop probable cause to arrest you, I find a needle and that leads to the next, to the next, to the next, then how does that fall? We'd have to go with the prosecutor on that and go, okay, make sure we're okay here, that we're not crossing legal boundaries there to where it affects the rest of an arrest if something else comes out of it. And like Dr. you said, it's not just the used needles. Quite often they're carrying loaded needles. And so when they get stuck with a needle, not only are they exposed to whatever diseases could possibly be associated with it or health issues, they're also associated with what's in that syringe.
So this is, again, one of those discoveries that just, oh my, more partnerships, more talking, just more things to think about.
So, what the ideal syringe exchange program would look like.
To begin.
To begin with, would be, you know, like a mobile fixed route of service. It'll be a half a day, Shelton, half a day, Belfair, half a day, you know, north of Skoke, and then maybe half a day out by Squaxin, something like that. It'd be a one-for-one exchange. Access to materials for, you know, clean syringes, cotton, things of that sort. Access to locks and kits, as well as the training and education involved in that. Access to health education materials. We've spoken to a few of our local nursing students that they were interested in possibly partnering, you know, providing some soft tissue wound care, that kind of thing. Access to drug treatment resources, and same thing on the second one. All right. So getting into budget, so startup costs would include liability insurance. We had started out thinking about possible RV for our vehicle, like Grace Harbor does, but a couple of great minds this last week thought of doing like a county truck and a hauling trailer to kind of cut down on some of those costs, because maintenance on an RV can get rather expensive. Staff, we kind of budgeted this out to be a 0.4, be about $40,000 for the year. Cell phones for safety and communication, and we're estimating startup cost to include about 300,000 syringes, and that would cost about $26,000.
So I'm assuming that then the people who man these at half day at these locations, those are volunteers. It's part of K. 0.4 isn't going to cover that.
Well, you would start out with paid staff first, and I know a lot of programs uses volunteers, so you end up bringing them in, and you train them to help you, but you have at least one. Even if you use volunteers, you would still have to have paid staff.
So that looks like under budgeted then.
That is like a max. When we're talking about, it isn't every week that you would go out to all the locations. So we're talking about distributing it some, in and around. You're just going to spend part of your time up north, part of your time down in the south end, and maybe every other week you're part of the time going out to Squaxin, part of the time going to Skoke. I think as staffing, that's the 0.4 is the bare minimum to run a program. And you tack it up to 0.5, then you're talking of a bigger budget because of benefits and all those as well.
And going into ongoing costs, of course, maintenance of vehicle, gas, insurance, supplies, staff, storage for all supplies, as well as used syringes, and then the disposal of syringes, which Debbie had shared earlier. Dr. Yu has some
yeah, so I'm going to share this
comparison.
This is some of the stuff, and I'm sorry, it's not, it's apples and oranges, okay? Because they're not all the information is exactly the same. We just put together what we got from folks. So I just took the three syringe exchange programs around us is Thurston County, Kitsap, and Grace Harbor. Thurston County exchanges, and their numbers in 2017 is lower because they had some staffing challenges. But otherwise, they would be closer to 2 million needles exchanged. But they do keep track of Mason County residents by zip code, not by individual names of who comes in to Thurston County. So last year in 2017, about 10% of the syringes that they got were from Mason County residents. And this was about 86 individuals who brought syringes in. And they're what we call secondary exchangers. So they collect from their friends, take it in their vehicle, and drive over and exchange. In Kitsap County, they do about 2 million syringes as well. And they have a program, Kitsap County Health Department runs their program in Bremerton. And then there's another group called Ostrich Bay that does their mobile delivery. So they do a mobile exchange. Is that exchange or delivery?
It's by appointment, so they make delivery stops. So someone will call and make an appointment, and they will go
and deliver. So, so with them, they're talking about maybe they have 1 to 2 people from Mason County that come over and exchange for 25 to 30, 50 people each week. In Grace Harbor County, they have a little under 1 million syringes that they exchanged last year, and they have really no idea because they don't keep track of who comes from Mason County, but anecdotally they know there are people that come from Mason County. And we also feel that there are people who are not accessing syringe exchange because they're just not doing it. And those are some of the folks that we want to reach when we do our local exchange. When you look at the budgets, Grace Harbor did not give us their total budget. Kitsap County, for the health department alone, it's about 180 to 190,000. The budget is the most complete that we got from Thurston County, and it's about 285,000 for what they do. Right now, the only agency that uses volunteers is Kitsap. Thurston used to have volunteers, but because of staffing changes, that has not happened. But they're planning to start that back up again. So when you look at disposal, Grace Harbor County does the 17-gallon buckets with Stericycle. It's about $20 to $25 per bucket that they dispose of. Their cost for 2016 was about $13,000 to dispose of 760,000 syringes that they collected through Stericycle. Using the Connex trailer in the transfer station in Thurston County, their budget for 2018 for disposal is $1,500. So it's a big difference in using not only is it in the landfill area, but they also have, it's not using Stericycle, and it gets disposed of when it's full.
How does it get disposed of?
It gets trucked to Republic.
They either go to Intermodal in Centralia or to Roosevelt,
So regular landfill.
Yeah.
regular landfills that,
Yeah. So, so that is the, that's the difference in the cost. The Stericycle budget for Kitsap County is $85,000 for next year, for this year. And I think everything else is about the same. So the Department of Health has some funding available, and it's for supplies. So they have, so all three other programs receive about roughly $50,000 worth of supplies from the Department of Health. We're late in the game and we're not part of their budget. We did talk to them and they told us that they should be able to give us about $25,000 in supplies.
What about the revenue under Thurston County mileage and public health assistance funding?
That's the millage. I don't know.
Property tax for mental health
Last
substance
one,
use.
sorry.
Yeah.
And
Oh,
disabled,
millage, yeah.
developmentally disabled. Our monies currently go to pay for the bed, the room and board rates of inpatient, of folks for inpatient. It goes to Thurston County, and it goes into the big fund of paying for the room and board, people that are inpatient recovery services, because that's not covered by Medicaid, so we get another form of funding for that. I'm not saying it's not available, I'm just saying that's what it's used for.
So we were thinking that for what we are planning to set up, which is a bare bones syringe exchange, if you all were in agreement, it would be anywhere between 100 to 150,000. And that big difference between the range is the staffing cost.
But if you eventually went down to volunteers, then that cost would go.
I would argue that we could not run it 100% by volunteers.
No, that's right, but I mean, you would get,
Yeah.
you wouldn't have as many paid staff if you had
Yeah,
some
I-
volunteers.
Yeah, I think the .4 would be the minimum, even and as you expand the program or need more. For example, we wouldn't have our staff doing wound care, and you would work on bringing volunteers in to help with that. You would bring volunteers in so we wouldn't have to. For safety, you don't want to send one person out. You want to have two
Of course,
people.
yes.
And so you minimize staffing by using one paid and one volunteer to go out. That's how we used to do it in Thurston County when we had the volunteers.
Did you include the R&R and fuel?
I don't know what's ER&R.
Then no.
What was it? I didn't hear.
Is ER&R, you know, or at least fuel costs involved?
We didn't include this.
So there's a huge.
Yeah.
Dave Wyndham chimed in to let you know that CPAA has grant funding available for this opioid report. And I'll wait for him to track back how much he thinks is available.
Good.
So we also included, you know, other possible funding partners, Cascade Pacific Alliance, other grants, tribal partners, Mason Matters, and our public hospital districts. So community input. So over the last couple months, Ben Johnson and I have been engaging our community leaders about a possible syringe exchange, just having some discussions. And we've had some really good feedback. We've met with representatives from both tribes, from our city and county leaders, local law enforcement, EMS, local businesses, and schools as well. And we've there's been some great discussions. So if you know anybody else has any questions or whatnot, I will field those questions best I can, or direct them to the people that know the answers. So.
And last week you went on a field trip.
Yeah. Yeah. Last week, Commissioner Schutte, Commissioner Dorsey, and Chief Moody and I went down to Grace Harbor to ask questions, get clarification, and they got to see how the program worked. I don't know if, Chief, if you want to share how your experience was or any input on that.
We talked about the .4 being under budget. What you got to understand is they only do it once a week, and it's 4 hours once a week. And so I think what the map you're looking at initially is, you know, you only have somebody out at most 8 to 12 hours a week going through these spots and doing this. And like he said, they have an old motorhome, and you know, they were, while we were out there, we were looking at ways to cut costs on this, going, the maintenance of, we mentioned ER&R. Well, that, you can take away the motorhome and just find an old truck that the county has somewhere that can haul a travel trailer out there. You've eliminated the cost of engines, et cetera, things like that. And so it was brainstorming as we were out there. But it's sad that we're at this point, but it shocked me to know that they were 700,000 something needles that they're exchanging. And people don't just come up with, naively, I pictured people coming up with a dozen needles going, here you go, give me my dozen needles. They're coming up with hundreds.
Buckets, yeah.
Hundreds
Buckets.
of needles.
Dave Wyndham chimed in, said they told him yesterday just to write it up with what we want to get it submitted. No guarantee, but very positive. So it sounds like if we agree to want to do something like this, we have a chance to write it up.
And with the Department of Health, they can almost guarantee that we can get somewhere from 20 to 25,000. It could be more.
This year?
For this year, yes. But then we can get in on next year. The new budget starts in June.
Right.
So.
And as far as budgeting, there are about 4 organizations that fund syringe exchange in the country. Most of the exchanges do get funded out of them. Most of them don't allow pilot programs. So once we, if we do this, if we've been for a whole year, there will be other funding sources available. Right now, it's a little bit hard to get in on those, but there are some really great companies who, that's predominantly what they fund.
Mr. Chairman, he says, he's asking the board if we want, he can meet with them tomorrow for a more direct request. They came to him to ask that he request funding.
You're talking about CPA.
Yeah.
CPA, yes.
So I think before I dive into what I would recommend that we do, I'd open it up for questions or concerns.
Abe, I don't know if you can speak to this or not, but one of the things at our meeting 2 months ago was the fact that's why you see the needles on the side of the road, because they're trying to get rid of the evidence and not get cited for having a a used syringe with them. This needle exchange, do you have any idea how much of an impact that had? Did it cut it down 50%? Did it not have any impact at all?
You mean on disease?
No,
Or just
I'm
needles
just
on the
throwing
road?
it away.
Oh,
We asked that question to Dan down at Grace Harbor, and he didn't have a way to quantify that. His
Right.
feeling was it had an impact, if I remember correctly. He said that he felt that they saw less. You know, obviously it's not going to take care of it completely, but that's another opportunity that if we were to move forward, obviously we've already started a conversation with our law enforcement community. It's a way to get a message out there, you know, to our active using community, you know, letting them know that this is a community decision. You know, we're working together. We're not trying to make it more difficult, and that we're encouraging you to do it the safest way possible with the support of all our community, you know, members. So, but his feeling was that it had a positive impact, but unfortunately there wasn't a way to
I don't
quantify.
see how it couldn't, because that syringe is then valued.
Yeah.
So why are they gonna throw out the
good point.
window?
If 1% in Grace Harbor did, just 1%, that's 8,000 plus that didn't get thrown away for that
Wow.
purpose.
Wow.
That 1%, that's a little hard to argue with.
Yeah.
You know, we can argue if it's 10%, we can argue 15, but I don't think anybody can argue we're gonna get 1% because they turned in 884,000.
So I know in Thurston County, there were less syringes that would be found in, you know, a lot of places. There were still plenty of syringes to be found on the street, but there were less. And I know in King County, in one of their areas of King County, they actually marked the syringes that they gave out
Oh,
good idea.
to find out if the syringes that they were passing out were being exchanged or being randomly discarded out on the street. And they had people bringing in buckets of syringes that they found in their cleanup, and most of them, the majority of them, did not have marks on them. So that the people using the syringe exchange were not
contributing.
tossing their syringes. They were valuing their syringe and bringing them back in.
that's what Peggy said.
So.
that's good information.
Well, it's again, it's very difficult to quantify. It's all anecdotal. And so in King County, in that one area of town, they actually did that just to see what impact they would have.
As far as 68
Across the
Lydia?
U.S., we do have that
Yes.
data.
So
If you want to hear some of it, Christine has brought that.
Sure, please.
So in Baltimore, the number of discarded syringes was decreased by 50%. In Portland, the number of discarded syringes decreased by almost 2/3 after the syringe exchange started. So there are lots of studies that have been going on for about 20 years, both nationwide and globally. And there are hard statistics showing that it does dramatically reduce discarded syringes.
Good, thank you. Carrie, do you see this problem at the school? Discarded
It's not
syringes?
something that has been brought up in the 3 years that I've been on the board as far as, I don't know if you know more about that, but I have not seen any or heard any reports of discarded syringes
I guess
around.
the definition of problem in the schools takes on a different perspective. Whether the kids are, I say kids, whether the young adults are participating in something like this, I don't have any information on that. I can tell you that when we talked to the gentleman at Grace Harbor, one of his concerns was playgrounds and affected areas where kids congregate.
Yeah.
Finding needles at those places. And where I don't have numbers to give you, I can tell that it is not unusual to find a needle in a city park, to find a needle in a playground. And if there's access to those playgrounds by the kids from the campuses.
Yeah.
Our IV drug use, according to the Healthy Use Survey for school-age children, is pretty darn low. That's across Washington State. So the odds of finding a lot at the schools would probably be pretty low.
Okay.
You don't have that many users.
If I use the number that 1%, imagine though, that 1%, no, if 1% makes it to my William Hunter Park, of that 1%, that's still 90 needles that are not going to be found on Waggle Park, right down that corner where everybody's waiting on the bus. It may not seem like a lot, but it is, if you
Sure
think
it is.
about it.
Sure.
You know, one poke at the wrong time.
So moving to the other outcome their outcomes. And we really concentrated on syringes on the side of the road, but Hep C, decrease in Hep C, you know, I mean, do you have numbers on that as well, or outcomes there? And probably more importantly to me is how many people end up going into recovery as a result of, and I'm sure the longitudinal, are they still sober, is a hard question to ask.
Dr. I just was going to say, you're not going to decrease your number, because once you have it, but you're going to prevent an outbreak like you saw in Scott County, Indiana.
So when we talk about now being an ideal time, with Scott County in Indiana, they actually implemented syringe exchange after they had the outbreak. And what they saw was, you know, they went from 3 cases to 200 and then started the syringe exchange, and they plateaued it. Okay. What we would like to see here is our numbers low, remain low. And that is the way it's been in Thurston County for the last 20-some years. The numbers have been low and they remain low. All you need is a few people in your injection drug using community who share needles, and what Scott County, Indiana showed is how quickly the disease transmitted in injection drug using community. Once you get it. And we do have HIV cases. We do have hepatitis C cases. If we so happen to have 1 or 2 people in our injection drug using community that has HIV and hepatitis C, it could spread really quick. And we do keep track of it, so we will see it. But once it goes up, then we would be playing catch up and trying to plateau that rise. We'd much rather not get that rise, just keep it the way it is. So it's hard to say, you know, many of the communities, clearly in communities that have had large number of hepatitis C and HIV cases, it has helped to keep the numbers pretty steady. We always track, we always find out if somebody has HIV when we're doing partner notification, finding out if they are injection drug use or how they got their HIV or hepatitis C. It's part of our disease investigation.
Doctor, where do we go from here? What's next?
Well, number one, we're going to start on the public education campaign on how to safely dispose of syringes. We're going to do that regardless. It's just part of what we're going to do. The other the concept of the syringe exchange program that we're wanting to, that I would recommend that we start here, is a 1-for-1 exchange, doing predominantly an outreach to our injection drug using community for overdose prevention, information, resources about drug treatment, getting them Narcan kits, and in that connection with our injection drug using community, trying to do an assessment of their needs. I would ask that you direct our director to formally create a budget and present to the, I think it is the Board of County Commissioners that's going to make the final approval. I'm not exactly sure how we're going to do this, but because it's going to have a budgetary impact, even if we're going to go and ask for grants and other resources to pay for it, it's still a budgetary impact. And I think they were targeting September. You know, maybe we can get it started as soon as then. Once we get the go-ahead, there's a lot of learning. There's a lot of things that may be a little bit different. We have a lot of partners to learn from, and we're continuing to learn about things every day. Grace Harbor is similar in terms of size. What they saw was within a year of their operation, the numbers of syringes that they were exchanging just went high. And And we do know that operating a syringe exchange does not make people use drugs. So I think that is really important to reiterate. But the thing is that there are people who are currently not exchanging that are out there, and we want to reach them, get them to the harm reduction, to reduce their risk of infections, to reduce their risk of transmission of disease.
Because of the monetary potential impact of this program, submitting it to the county commissioners, why don't we make a motion forwarding it to the county commissioners, with the understanding that if they can't fully fund it, it'll come back to this board for future review and to look at grant opportunities. I think there's a lot of value here. There's a lot of, obviously, public health benefits. We aren't breaking new ground. This is a proven practice. So let's go ahead and start trying to protect our kids and some of the folks out there that need that help. So would somebody like to make that motion?
Commissioner thought, rather somebody else make the
Yes.
motion.
I make a motion that we, I don't know exactly how to put it, move this forward to the county commissioners for their approval to go forward with a budget, I guess.
To direct staff
To
move
direct
forward.
Dave and his staff to go forward.
Thank you. Thank you, Peggy. Is there a second to that
I
motion?
would second that.
Thank you, Gary. Any further discussion?
Commissioner Drexler, Pensive, thinking.
This is tough. I didn't realize that I didn't have to make a decision on this today. Obviously, there's another level, so I think I'm going to be abstaining. I wasn't ready to make a decision.
Okay. I don't think this is a recommendation to the county commissioners.
I understand
No.
that, but I mean, this
Fine.
is even
Okay.
at this point of it.
Okay, Terry. Appreciate that. Any further discussion?
There's one thing, whenever we put forward, as a group, I hope we're smart enough to go forward to the community and not just educate the benefits, but educate them why we're doing this. As somebody who's a recent converted person, I can assure you, in order to avoid a lot of pushback, it'd be wise when we went out and explained to everybody some of the benefits, such as we all know we're picking them up on the road, we all know we're picking them up in the parks, we all know our kids are getting into them. This is an opportunity to cut that way down, for one example. And then another, of course, is the other health issue. But I think this board should prioritize that as an education thing for them, for the public, not just the user.
Good observation, Ron. Thank you. Any further discussion on the motion? All those in favor of moving the issue forward to the county commissioners signify by saying aye.
Aye.
Opposed? With one extension. Okay? Thank you. Thank you, Doctor.
I think you had a, yeah, okay.
You're too official.
Are we, that conclude your report, Doctor?
Yes, sir.
Okay.
Thank you.
Lydia, can you follow that agenda?
Yeah. So you received my Community Health and Human Services Manager report. It should have in your packet. Lots of statistics we're trying to give you so you can kind of keep abreast of what's happening with my division, because we run about 14 to 15 different programs. And so that first one has some data on there, because you were asking about the hepatitis C. So you'll see hepatitis C chronic in there. Our monthly for the first 2 months, or for 2 months, was 23. Now, chronic means they've already had hepatitis C. Our acute hepatitis C, meaning someone that just came down with hepatitis C, is usually stays pretty low. We get maybe 1 or 2 a year, if that. So again, to play into the syringe exchange, that we'd like to keep it there and not see that skyrocket up. I don't have the HIV numbers in here, and so we're going to hunt those down from the state. We used to have them because we used to do the HIV program, but since it was taken back by the state for funding reasons, we don't get that data very well anymore, so we're going to kind of work on that a little bit. In the next page, I just want to highlight a couple things in here. So the housing, our housing program, homelessness program, just to say that Lifeline, Community Lifeline, this year they got money from our housing dollars to run their cold weather shelter for 90 consecutive days. So there's a little data in there about what's happened with that, and so it was, prior to this season, they were never full, basically. We learned that as we began to investigate it. So we discovered when they ran it, and part of that was because nobody would know, people that needed to use it would not know if it's open or not. And if you're coming from the forest, how would you know if you came in and then it wasn't cold enough? So the 90-day was kind of a pilot test to see how that went, and it actually went really well. They had 92 different adults that used the shelter, with 20 to 25 staying each night, and they reached their capacity of 35 5 times during that time period. So that was a big jump from what they previously had. And then there's data in there on the unofficial point-in-time count, which is that national day where everyone across the U.S. counts who was homeless the night before or in a shelter. And so those are the numbers there that kind of show, and I just wanted to bring up that for the totals of the households that we counted that day in January, that evening in January, 68% were chronically homeless people. So that kind of, I'm real proud of what Todd and the group, the team of the community working with the homeless and housing issues have done a really good job of getting us some really concrete data for the past few years that we're now beginning to just look at and figure out, okay, where do we need to go next to help. So that's just a few things to highlight. And then on the mental health and substance use prevention and treatment, our TST, what we call treatment sales tax, we're going to get you all familiar with the sound TST because we hated that other long name we had for it and nobody could remember. And this is what they use across the whole state. So it's our treatment sales tax that we use to fund mental health and chemical dependency treatment services. And so right now there's 2 agencies besides our therapeutic courts, which involves a number of departments that are getting some funding. And a new one is the Behavioral Health Resources that got funded this year. And they're embedding behavioral health resource therapists into 5 to 7 schools with a focus in North Mason rural community. And the therapist there is currently seeing 44 children. And then the note they made was, one of the largest challenges that they're seeing as the North Mason area is substance abuse and absent parents with children being raised by extended family. So that was just something. And then Northwest Resource has some the last 2 quarter data there for you to look at, and our therapeutic courts, some data. There's much more extensive data than this that we're getting ready to release a report on.
I have a question about homelessness.
I know that someone was saying one time that if you live with a family, you're not related to that family because you have nowhere to go and you live, you're considered homeless?
Not according to the federal and HUD guidelines, no.
Okay, all right.
And I don't know those off the top of my head, but I tell you, Todd could rattle them off. But there's very specific guidelines, and that's one of the things we also did in the last couple of years, is really get the definitions down, because this HUD has different than the Fed sometimes, and then the schools, actually, OSPI has different quotes for what they call homeless. So we tried to define those in the report that recently went out so that people could understand sometimes the numbers are apples and oranges. So be careful what's considered homelessness.
Okay, thank you.
Great question. And then housing is one of the primary challenges of the therapeutic court participants, is another thing I wanted to highlight. Of the 59 participants, 24 became homeless during the program and 8 dropped out due to lack of housing. So our courts and those that are dealing with chemical dependency and mental health issues in the community are struggling because we don't have housing, which to stabilize somebody in those areas, they really need to have stable housing. So it's something that our housing community is also looking at to figure out some creative ways to get some housing available. Then the substance abuse treatment and prevention, which is basically Ben is funded from DBHR, Department of Behavioral Health Resources. Sorry, didn't mean to use acronyms. And he works with the Shelton Coalition, the Prevention Coalition, And then he's going to tell you about the North Mason that just started, and also about a letter and some information.
Oh,
So
sure.
turn it over to Ben.
Yeah, Ben Johnson, Mason County Public Health and the Shelton Substance Abuse Prevention Coalition, and the newly started North Mason Prevention Coalition. We had our first meeting last week. It's kind of exciting. It was kind of like herding cats that night. But it was fun, and I think it's going to be a process to educate between prevention, intervention, and treatment process, and just to get everybody kind of on board. It was a great team, it was a great meeting, and hopefully we can continue it that way. But I'm here to actually talk a little bit about an issue that's come up in Mason County and in our area in the last few months. We had a counselor from the STOP program. She's also a mother. Her name is Jamie, and she is also on our coalition. We have a couple of coalition members here. Chief Moody's part of it. Mr. Scotty Mills is part of the coalition. They're here to support and talk a little bit about huffing and air duster sales that's going on in our small stores and our larger stores. One of our larger stores gets a lot of air duster. It's that computer duster that people steal. They buy it actually too to get high. And it's not always our younger people, it's kind of the whole gamut. And I think Commissioner Netherland even had somebody come up and approach you a while back about this issue. We had one overdose in the last month, and that's actually fairly significant. So I don't know if Chief Moody wants to have any input on this at all, but I'd like to give him an opportunity to talk about what he's seen in the community. And then I have a favor to ask of you guys through our coalition.
I didn't even prepare, but one of the things that came up in the community in the last couple of years is the bigger stores, and I'll name them, Walmart, Safeway, and it stemmed from, at first it was alcohol. Safeway had their alcohol set up right in an aisle, right near the exit doors. The kids would walking in, walking out with the alcohol, and then they go down to the creek down here, bust open the bottles, and they're drinking. So it's all these different things that it causes. I mean, there's broken bottles laying around, the kids are drinking, which is the primary one, and the theft from Safeway. So, the same token, we met with Walmart and discussed with Walmart a couple of years back about spray cans. Not only gang graffiti, I said specifically blue and red is around town quite a bit. And I said, they're stealing it from you because you're not locking it up. You have to be 18 to buy it. Can't you just put it into a cage like everything else? You've got razor blades in a cage up there. I can't buy a razor at Walmart, but I can walk in and buy spray paint or steal spray paint. And they're also using spray paint similar to the huffing. So now we're into this same boat, and we wrote letters to the corporations to discuss this. At one point, Walmart was on board with the spray paint, and they since changed managers and have gone a different route. But it's those type of things that are really simple fixes. But because they're size of the corporations, it becomes an issue. Again, it just amazes me what we will lock up and what we will not lock up with these stores. I can tell you I've seen the effects of this. I've seen kids firsthand on this. And when I say kids, I'm talking about up to age 30. Firsthand walking through campuses or places around schools that are doing this. They're going in and either somebody's buying 10 cans of these, which should raise a red flag automatically, or they're stealing it. They're going in and stealing it from the stores and using it for a quick high. So that's my take on it, and that was where Ben and I first started working, was the alcohol, the spray cans, and now with this.
So, somebody else up? Oh, did you have anything to say?
Well, I'm here as an advocate. I'm Scott Mills. I'm with the Realtors, and a big supporter of community health, kids, and seen it in different communities all throughout the Southwest that I've lived in and up here. I'm personally touched at home with it. I have a stepson that's an addict, and we're working through that. He's doing well. Update, so doing really well. So next month is our National Association of Realtors Open House, and I was just sharing with Ben that not too long ago, walk up to an open house, get prepared for it, and there's a syringe right there in the walkway. So definitely, if there's any materials or word that we get out to our communities and go out and approach our kids and talk to them, I embrace the opportunity to do that.
So, a couple of weeks ago, I did a little survey of stores. I went to Walmart, went to Safeway, went to Fred Meyer. Most places, and this is just the Shelton area, and then about 10 of the small convenience stores. Most places take care of business. Walmart told me that they get a lot stolen at the end of the month. The beginning of the month, people are actually buying it, but it just disappears. A lot of the convenience stores, or at least about half of them, just have it up on the counter. People do walk out with it. They jack the price up a little bit on the air duster. The other thing they sell are these little Whippet air compressed air tubes, and kids get high on that too. And I literally said, so why do you sell this, you know, at your store? I mean, I just can't get over why a convenience store has to sell air duster by, you know, the half case or so. And none of them wanted to really give me a good answer to it. We all know we're talking the same language. So, so my ask to you through our coalition is that right now we want to do another letter before we go any further, and it's just ask all of our store owners to partner with us in at least locking it up, putting it behind the case, doing something to help protect our children. So, so the letter would come out through our coalition with the support of you guys, to the Board of Health, and send it to all our convenience stores and all our stores in our community, north and south.
It says even if they buy it, they'll cut back. You know, even if they're forced to have to buy it.
Right. There's no law against it.
Steal it easily, it'll cut back the use of it. And if anybody hasn't seen, there's different ways that they do it. They've been described as being walking zombies, you know, literally funky moves. There's all kinds of stuff about them that look like they're Walking Dead people, ones that do paint. I don't know about this other, but it's pretty amazing the lack of control they have as they're coming out. They actually look like a zombie, they act like a zombie.
We had a call a while back at Oakland Bay Junior High. It wasn't a junior high kid, it was an older kid, but he was walking through the field behind there, and people thought he died. They watched him collapse in the back of the field there, and I happened to be up there, and it was like The Walking Dead. Yeah. He had no idea where he was or what was going on. On the flip side of that, there was recently a lady admitted into the hospital here where I saw blisters on her mouth that would make you cringe, and it was from doing that habitually.
So Ben,
Yeah,
do you have
frost? They actually get frostbite. Yeah.
Because the can gets cold.
So Ben, do you have a request of the board?
Yeah, just the request to support the coalition, because the coalition is basically, I work for Mason County, and I coordinate the coalition, but I didn't want to just send out a letter through the coalition without you guys knowing about this too. So the letter would be probably approved by my supervisor and the health officer.
I move that we allow the chair to sign on behalf of the Board of Health support on this letter.
Okay. Is there a second?
I second that.
Any further discussion? Okay, ready for the vote? All in favor of supporting the letter, signify by saying aye.
Aye.
Opposed? Motion is carried. Got it, Ben.
One other thing that's on the lock boxes that we were talking about earlier, the new law passed just recently, so all pharmacies are going to have take-back boxes, prescription drug take-back boxes in summer of 2019 is what they're projecting. So that'll be a big deal.
So then, can you also bring a letter for recommendation to the Mason County or Mason County Commissioners as well?
Sure.
And
Want to co-sign it?
yeah, or I think everybody should want. So I can't speak for the Board of County Commission. I don't know if they want to co-sign it. I would like to see it brought before us for us to have a discussion at a briefing this evening.
Fine. Well, if that discussion is positive, feel free to tag on to the Board of Health.
And also, can you give me the contact information for that person who put on that meeting we had up in North Mason?
Joni?
Joni, yeah.
Joni.
I was able to pick up 70 of them. I bought them out of everywhere I could find out. Some citizen had an incredible idea, kind of, that she was talking about even if you just had a drug test, to be able to hang over the kids and say, listen, I have one. If I see you coming home, I'm going to test you, you know. The impact it may have of keeping the honest kid that's in the 6th grade from becoming that user kid that's in the 8th grade when they're showing the numbers. And that was a wonderful idea, so I went out and bought a bunch of them and building to our elementary school in North Mason for this person to start to give out to parents to utilize. I think we ought to consider it cheap enough, you can get it, you just can't get all you need. And not everything I can get my hands on for that. So, I thought it was a wonderful idea from a citizen. And so the school has already agreed to do that. They'll notice the parents, let them know they have to have a marijuana testing kit.
Is there any liability back to the?
Not for me, I just donated it to the school.
Okay. Gotcha. Lydia, anything else?
Yeah, almost finished.
Okay.
Because I know we have a health ranking report that takes about 15 minutes coming up. So on the last page of my report, it talks about the Mason County Opioid Response Plan. And just wanted to bring to your attention on the distribution and naloxone, the overdose reporting there. It's what's reported to us. It's not going to tell everything that's not reported. And there's lots that are never reported. So it's something we're going to get a handle on with our new grant, but just so you know, we're going to change it and say that these are reported to us. And then our new comprehensive opioid program that we got from the federal government, the grant, we call it COPE. It's Comprehensive Opioid Abuse Program, is what it stands for. And we finally got to get rolling on that after learning that the federal government has different ways of how they start grants, different timeline. But Abe and I and our researcher went to Washington, D.C. at the beginning of this month for 4 days and had our orientation and training. It was excellent. It was beyond our wildest dreams. They are actually letting us change the grant focus a little bit to what our community needs, which is more of, because we're already doing overdose reporting and we've been working on that with a different grant, they've allowed us to switch it to where we're going to be able to do more of a coordination and set up some kind of system level change where anyone that's needing recovery services, treatment services, they're going to have a no wrong door approach. This is what we're aiming to do over a 3-year period so that people can get into treatment and be followed. Plus we're doing research on this, so it's all going to be tracked. So we're really excited that they allowed us to do that because we had no idea if they would, but they said they were excited about it. And then I just wanted to share with that that Abe, he went with me and we got to speak. We were invited to an extra day because we're a rural community. We're the only West Coast grant that was given, and so, and I think we were the smallest grant as well in number of population when you're looking at either the city or the county that was being looked at or the community. And Abe, so we got different times to share, and Abe just did an excellent job in one of his sharing sessions, and he got applauded, and then he got asked by the director of the conference to speak at the next national conference that we're going to in DC in August or September. They're still undecided on the date. So I just wanted to give the kudos to him that he did an excellent job, and I'm very proud of him.
Good job.
And they were very impressed, and they're very excited about Mason County and what we're doing here. And then just wanted to ask with that, just that the Board of Health would support this project, this grant project, as us leading kind of a community, not a coalition, but a community system, beginning to work with all our partners, including the courts, the behavioral health, the chemical dependency, the mental health, the hospital. That's kind of what this grant's all about, is pulling everybody, law enforcement, pulling everybody together and seeing what our pieces are and how we, as our grant, can help coordinate services across the county. So wanted to just, ask the board if they're willing to back us in this effort, because it's beyond just a little program. It's literally a massive community-wide initiative that we want to help support our partners that are doing such great work here, but it's difficult sometimes for the court to know what's happening in the north end, or the law enforcement to understand what may be happening in the hospital, although there's great groups getting together in our community now in coalition that are working, but.
So this is kind of what we had talked about at our last meeting up in North Mason. At that time, we didn't have clarity on the scope of what we could do with this grant, and it's very clear now that this grant is allowing us to do the coordination.
Yes, correct. You're correct.
All right.
So we're very excited about that. Yeah, it's a whole different focus than what it was
So
started
with your support, we would like to put that out there as, yep, we're gonna be here, not just trying to be a dashboard, but to actually help to coordinate all the efforts, not just what's going on in North Mason, but what's going on with law enforcement, what's going on with Prevention Coalition.
What does that look like staff-wise? How are
We
you?
already have the staffing from the grant. So in other words, it's.
You're just looking for us to say, we support you.
Well, we don't, yeah, we want you to understand what we're doing with
Yes.
this grant and the change of focus that happened with the grant. I mean, it's still an opioid response. Dr. Yu started with an opioid response plan before we got any grants, and we're following that plan still. We're not deviating from that, but we're just gonna help do a little more coordination, which the grant, when it was written, was not written that way, because that's not kind of what they asked for in the grant proposal. But when we got there, we found out that they want us to do whatever we can do as a community to explore. That's why we have a researcher. We can figure out if things are working, not working, shift things. So we have a lot of liberties that we didn't really understand we have. So we asked them, well, we'd like to be able to kind of coordinate the services going on in the community. And they were real excited about that, as was our researcher, because we're kind of like a little experiment here. And we're small enough that we can get all the partners together and we can work together. And so they can see what will work and what doesn't work, and they'll be able to see that data come through to the federal level. They actually gave our researchers some specific things that they have no data on. They said, if you can collect this and find out some things, we'd be thrilled. So anyway, so that's kind of why it's a little bit of a shift.
Lydia, do you need that recommendation, that endorsement today?
No, I'm just.
I would move that we do endorse them today. I mean, we're not.
I mean, we're going to do our grant, but we kind of would like the Board of Health behind us.
It's just kind of a, yes, I think that we should move forward with that as an endorsement.
Okay, is there a second to Peggy's motion?
I second it.
Okay, discussion. Lydia, my concern is, I don't understand, it's only my second meeting, so I guess I don't understand some of the history and
I
where we
don't
got to
either.
this point.
The
And,
history of.
Dr.
Right.
Yu's opioid
Uh-huh.
proposal and program and things. So if you don't need it today, I would suggest maybe you give us a little bit of information in the next packet, and then we'll be more than happy to go ahead and discuss it then. If you
Sure.
need it today, we'll go ahead and take a
Well,
vote.
we're
one way
going to
up or
continue
down.
with the grant plan, because we don't have a choice. So.
If we're in discussion aspect of it, I have a little bit of concern I'm trying to figure out in my head. That's what I'm dealing with. Because of all the work that's been occurring up there and happening, I know there's a group that's looking to do that already. So now,
That's in COA, she's
well, no,
coordinating.
I think it's somebody that's going to go over the top to actually do the coordination that hasn't occurred up to this point. That's what they were looking to do through that Kitsap Health thing.
The problem with an agency doing it is it's an agency doing it.
We're an agency.
Well, but we don't have a hand, we don't do services, so to speak. So in other words, public health kind of is looking at everything that's going on. An agency, any agency, is going to look at what's in their sphere.
Not necessarily, no. But I would like to see what yours looks like, I guess, because just the conceptualization of it, the words, just like I'd like to see what they're putting together. I'd actually like to see
Well,
what it is
they're part of the group,
that
so
everybody's doing.
we definitely would like to see that.
But
Yeah,
that's just
you're
my
coordinating
2 cents.
with them, I would assume.
Oh, of course.
Yes.
We would be
Are
coordinating with
you
everybody.
working with the lady from Kitsap?
Yeah,
have
we
been-
will be, and,
Well, you already are though. Is it-
We
Right.
are. We
Right,
are.
right,
From day
right.
one, we've been working with every agency. So yes, we're working with
And
her.
so you're just asking for our support to continue doing that, is what I'm.
Yeah, it's not that big of a deal, but it seems like it might be a bigger deal than I think it is.
Sorry
It's
about
just
that,
wanted
Lynn.
to kind of let the board know that the grant had a shift, and that's how we're moving forward with the grant. And so we're not over any agency in the community. We're not telling them what to do. We're actually going to go invite them to be part of the research project so that they can collect data. They may have things that they want to know that they're working on. Is this working? Is this not working? So it's an opportunity to bring the community together and just continue. And I have to say, there's numerous things going on already in the community. But they sometimes don't even know they're having meetings across the community, that group's meeting and that group's meeting and that group's meeting. So we have a grant, is what I was bringing to you all, that allows us now to help coordinate. That was kind of fun.
And you're gonna do it anyway. whether or
Well,
not-
we were,
Yes.
well, yeah, we've been,
So,
we've taken the money and signed on the dotted line. So, yeah.
so you were just asking for our endorsement.
Yeah, I was letting you know that we've made this change, and this is something we're going to be working on with all the community partners, and inviting them to be a part. They don't have to. There's no requirement for anybody to be a part, but we're going to invite them, kind of share with them what we're going to be doing.
Yes, my concern is, you were there at one of them, but the last two or three, there hasn't been somebody from your.
Well, I was there at the one before this last one, but the last one, when that decision was made was when we were in DC.
We were in DC.
When we found out.
Yeah.
But you know, moving forward, now that we have a better idea of what's happening, none of that work is going to change. That's going to continue to work. But my job or task is to be that person to coordinate. So just hoping to continue to partner with that group and moving forward, you know, all the work we've been doing with Bo and, you know, all that will continue. It's just, you know, the main task for me is to continue to, you know, work in interagency communication and create MOUs, and then bring on our external evaluator as well and find out, you know, what is working, what isn't working, what are the needs of the North End, what are the needs of Shelton, what are the, you know, all that kind of stuff, and finding out where we need to fill some of those gaps and what barriers we're facing. So the position you're talking about is will be funded, you know, through this grant. So.
Any further discussion? Are we ready for the vote? All in favor signify by saying aye.
Aye.
Any nays?
Nay. Just because I don't know, I want to see what it looks like. But, you know, right now it's just a guess. I'd like to see what it actually looks like. Because I think this is extremely important for us. We have to do this. So I want to make sure that we're actually doing it with everybody and pulling them all in, not coming in after the fact when they're already doing it. Because there's a lot going on.
So we're, in the next 2 months, we have on our timeline, we're going to actually have some visual documents and things that we can get to everybody, and that's the goal, so that people, I'm feeling that people still have struggled because there's no visual. So we're putting that together right now, and then we're going to get feedback from all the partners on it. Because no one is actually pulling together everything that's happening, because it's a lot. It's really a lot.
Sure.
So we want to pull together what we're aware of and then share with partners and let them fill in what they're doing, maybe that we've missed, and then also then figure out part of what we have to do is where are the gaps? Where do we not have anything happening? And that's maybe where the group, the community decides, oh, we need to really fill in this area here. We need to figure out what to do. So we're working on that, and as soon as we have it ready, we will be bringing it forward.
I'm not going to stand against it.
I hear what you're saying. I hear what you're saying.
The knowledge
Yeah.
that comes with it.
Totally hear what you're saying.
Conceptually,
Yeah.
it's good enough on this one.
Yeah.
I'm looking forward to your visual.
So am I. We're all working really hard on it. We're not these people that, you know, the infographics that figure this all out, but we have some that do, so we're
Good.
going to pull it together as best we can.
So unfortunately, I've got to vote nay also at this point in time, but look forward to that presentation.
Okay.
Motion is carried. Thank you. next, is that it for you, Lydia?
I actually have one more thing, and I'm terribly sorry. that
You
this is
sure?
taking a lot longer than my time would.
Okay.
I normally don't go through this, maybe next time I don't. So just real quick on the emergency preparedness, Dave, and are you still on the phone, Dave? Let's see if he kids, because he might really speak in here, or on the, whatever you're on. He's on a camera, I guess, somewhere.
watching.
Yeah,
He's
he's
watching.
watching you,
Okay. So, Region 3 Coalition of Emergency Preparedness Partners, which is made up of our 5 coalition, Grays Harbor, Pacific, Lewis, Thurston, and Mason, has been informed by the state over the past couple of months. They've been working on this for a while, but they finally made an announcement that they are going to dissolve the coalitions around the state, the emergency preparedness, and the support that was going to them. So ours is called Region 3, that's been around for many, many years. And they're going to go to only 2 regions in the state, one on the east side and one on the west side. And the west side region will be operating out of Seattle, and it's the Northwest Regional Network, I think it's called, Healthcare Network. And they've actually been the Seattle Coalition for many years. They turned it in many years ago to a 501c3, and they've been operating for a while. And the state feels that reducing the coalitions down to just the east and the west is what they feel needs to happen. So the regions are kind of reacting because our partners, we have a really great Region 3 coalition that is attended by not only public health, but EMS, all the hospitals in the region, the emergency managers in the 5 counties, the long-term care people. So we have a very large coalition that meets every 2 months of about probably 60 to 80 people. Very active in kind of trying to partner together as what we would do in various emergencies, making sure we have coordination. And the derailment that happened in Olympia was a great example of it. Had some really good responses because of partnering and things working really well and all the years that this has been going on. So our coalition wants to stay operational, even though the money to operate it is going away, which means we'll bring our sack lunches, but which is fine with everybody. But we wanted to kind of let you know, and then Dave asked me to request of the board a letter of support from the Board of Health and find out what your feelings were about this. But he felt the recommendation was that we'd like to continue to have boots on the ground working together and not just be represented by an east and a west when it's hard to know what's happening in smaller communities when people aren't talking to each other. So we're very concerned about that. And we don't know how it's going to go. The board of Region 3 is meeting and kind of trying to decide, well, how could we do this without the financial backing of the people that sent out the, arranged the meetings, got the lunch, set everything up. So that hasn't been discussed yet. It won't start till July 1. But we're going to have our next meeting this month, April, and we'll be talking about that and deciding what to do. But Dave had asked if the board would consider supporting us in a letter to the state about how the importance of having regional meetings and coalitions and things to support, especially smaller rural communities that don't really have the advantage of being on I-5.
So is he gonna have a letter for us?
Yeah, yeah.
And he's still on and listening, so.
Yeah.
So I always like to know the legislative intent behind some of these things. If it's a cost-saving measure, I get that. But so many times there's a legislative intent between making a change, and so sometimes status quo is kept if you don't really know what the legislative intent is. So for whatever reason, if it's a cost-saving measure, I get that.
That's about all we can think of at this point, that it's cost savings, and I think probably a little bit more of a centralized for the state to not deal with 9 regions, to deal with 2. I'm sure that has a piece in it as well. They can have a little bit more focus and control of what's happening. And they're supposed to be sending out a regional rep, we're supposed to have a regional rep from each region, even though the regions aren't official anymore, that goes to these meetings, but we can't quite figure out how would they come back and tell us anything if we don't have meetings, so we're kind of still all a little confused about it.
And Dave was meeting with the other health directors on Friday.
Yeah, because the directors, yeah, they're all kind of talking about it and concerned. So we'll have a letter, but he wanted me to inform you.
So he doesn't need an action right now.
No.
So we'll wait to support that letter once we go ahead and see it. Okay? Sounds like something we can go ahead and do. Anything else, Lydia? Okay, thank you. Do we have Dave's report? Anybody be stepping up and
I hope I'm not reading that through text message.
Yeah. He sent it to everybody, yeah.
Okay, fine. Thanks, Dave. Debbie?
And mine too is in your packet, I won't go over it. The one thing I wanted to talk about for a couple minutes is the 2-pager about drinking water. That was developed and given to our folks in the legislature to support that program. And since that was developed, it was the drinking water program as it was, made it into the budget, and we have it for another year. We're hopeful that it will expand a little bit in the next biennium, and we can go to a full delegation program here in Mason County rather than a partial delegation. So that's all I have for, yes, ma'am.
What would be the alternative, that the state would then do the inspections and whatnot on Group Bs?
That's one alternative. We've taken a partial delegation, and through this funding, they pay us $5,000 a year for those.
I get what we're doing
duties.
now, but what was their hope, that the Department of Health would take over the Group Bs?
Not the Department of Health's hope. They did not want that at all.
Okay, so we'd still be responsible for Group Bs, just not funded.
Thank you.
Got it, thanks.
Yes. That's it.
Thank you, Debbie. Allison? County health rankings.
So for those of you who don't know me, my name is Allison Smollett, and I'm the new health educator. I put myself in the health educator role at Mason County. And today I'm going to be talking about the county health rankings, where we currently stand in the rankings, as well as some measures of interest to this board. So for those of you who don't know, I'll give you an overview of the county health rankings. They are a snapshot into how our community is measuring in over 30 different measures. The rankings can be used to find and address health challenges in our community we may be experiencing, as well as identify gaps that may exist. So there are 2 categories that go into the county health rankings. The first is health outcomes, which measures our health today in the county. And the second one is health factors, which are predictors of tomorrow's health in the county. So I'll explain a little bit more about that as I go on. So in 2018, this year, the ranking that Mason County was given was 28th out of 39 counties, and this was the same as last year's ranking, so we didn't change from 2017. However, in 2016, we were ranked 29th, so we are improving slightly from 2019. I'll add the caution, though, that these rankings tend to not change from year to year. And the reasoning for this being is the way that we're measured, the way that we're evaluated on each measure. So for example, being a rural county, we score lowly in a measure called access to exercise opportunities. And the reason we score low is because the majority of our people, or the majority of our residents, don't live within 3 miles of a recreational facility. So as a rural county, we're always going to score low in a measure like that. So that's kind of why we stay consistent over the years. So for the health outcomes, as I was talking about, this measures our health today, and we're ranked 28th, so pretty good overall. I go on to length of life. So the length of life measure contributes to 50% of the health outcome ranking, and generally we don't compare measures over time because of changes in methods. However, this year the county health rankings released a group of measures that they felt comfortable trending over time because they had kept track of them and made sure their methods hadn't changed. So I'm going to be sharing some of those as I move on with this presentation, some of the ones that we can trend over time.
So for this measure, Mason County is improving in our premature death rate. In 2018, the rate was 7,500 years of life lost per 100,000. So as you can see from the graph, we're definitely improving in this measure. Does anybody have any questions about this graph before I move on? Okay, feel free to stop me if at any point I'm talking too fast or you have a question. So our leading causes of death in Mason County, our top cause of death is cancer. This is pretty similar to the entire U.S. as a whole, so no shock there. The remaining leading causes of death are cardiovascular disease, accidents, chronic lower respiratory disease, and suicide, all in that order. And from the chart, you can see the different numbers of cases that we have for each of those. So moving into health factors, as I discussed before, this is a measure of our health tomorrow. So what will our health look like in the future in Mason County? And for this, we are ranked 37th. So definitely some room for improvement here. So now I'm going to talk about some measures of interest that go into the health factors map. So the first one is obesity, and we are getting worse for the measure of obesity over time. In 2018, 31% of adults were obese in Mason County. And I'd like to add in, so this is based on survey data, and it is generally known that in survey data, people overrepresent their height and underestimate their weight, right? So I do it too. My license is not the same as, so it's probably likely a lot higher than 31%, but what we do know.
What
Sure.
definition of obesity are you using?
Yeah, so it's based on the BMI, and it's anything greater than 30 kilograms per meter squared.
Okay.
So
That's
30.
consistent with the federal?
Sure,
Okay.
yes, yes. So if we look at obesity comparing to some of our neighboring counties in the state, we are doing much better than, well, not much better, but we are doing better than Grays and Lewis County. However, for the state average, we're not performing as well as the state. And this is the same for physical inactivity as well. We actually aren't performing very well for how active we are. But again, that goes into that access to exercise opportunities. We don't have as much access in our county. So when we compare STI rates of sexually transmitted infections in Mason County, we're getting worse. In 2018, there were 372.3 cases per 100,000 of newly diagnosed chlamydia cases. And chlamydia cases are used as a good estimate for STI infection rates because they're a reportable condition, so we get those reports at the local level, so that's why they're used as the measure for this. So if we compare those STI rates to neighboring counties, we're a little bit higher than Grays and Lewis. However, we're doing better than the state. And something I'd like to point out on this graph, Grays Harbor is really low, and they mention in the rankings that this is a possibility that it can happen. When you have a rural county, sometimes things are underestimated because they're not capturing how many cases are actually exist because people aren't coming into the clinic. They don't have the capacity that a bigger county would, so they're not able to capture a realistic number. So that's likely a very underrepresentation of what their actual rates are. So another measure of good clinical care is the number of preventable hospital stays. Mason County is improving for this measure, so that's great. In 2018, only 35 per 100,000 hospital stays were preventable. And what that means is the rate of hospital conditions that with appropriate care could have been avoided as a hospital stay. So there are conditions like pneumonia, hypertension, diabetes. With proper preventative care, you could have avoided a hospital stay with these conditions. So that's what they're capturing with this number.
Are you seeing that too?
Yeah, he's got
Good
it.
job, yay!
Are you guys seeing that too?
Are we seeing it?
Yeah.
There's a lot of emphasis on
Yeah.
In case you don't remember, Commissioner, when we first came into this, we were 35 out of 39.
On the Venable Hospital side.
No, for our.
I remember the overall ranking.
Our ranking, yeah, we were 35.
So it looks like back in 2007, we had 60, so we've almost cut that in half. That's good. So if we compare those same numbers to other counties near us, we're doing better than Grays Harbor and Lewis County. However, the state is still performing a little bit better than we are. So, now looking into social and economic factors that affect health, Mason County is improving for the rate of high school graduation. In 2018, about 74% of our 9th grade students graduated in 4 years. If you look at where we started back in 2010, we're definitely showing some improvement. However, however, if we compare ourselves to Grays Harbor, Lewis, and the state, we're still underperforming for that measure. So it's something we can definitely look to improve on. And as well, on this graph I have the number, let's see, half of adults aged 25 to 44 have some post-secondary education, so some college education. Only half of our citizens in the county have that. So another social factor that affects health is poverty rate. Mason County is currently has 23% of children under the age of 18 living in poverty. This is getting worse over time. The definition of poverty for this particular definition that they used was a family of 4 with 2 children under the age of 18 whose income was below $24,858. So not a whole lot. When it comes to trend data for unemployment, Mason County is staying the same, so not really a whole lot to report there. The current rate is 7.8% of people 16 years and over were unemployed but seeking work. If we compare these poverty rates and unemployment across counties, Mason County has the worst poverty rate for children living in poverty. It's kind of just going to happen in a rural community, but it's something we can maybe work to address. And the unemployment rates are pretty consistent. We're doing well comparing Grays and Lewis and Washington. The next social factor is violent crime. And in 2018, the rate was 231 crimes per 100,000, and this rate is improving over time. Sorry, I know it's very graph heavy.
What's a crime?
So violent crime is anything where...
Felonies?
Yes, so let me look at the definition. Reported violent crime offenses per 100,000 is the definition.
I don't know what it means.
Yeah, so I can look into that for you guys and bring it back, because I'm not sure what their definition of violent was.
Can it be any harm to a body?
I would think, but I don't know for sure.
A person broke into a house and left versus a person breaking into a house.
Sure,
and
like
killing
petty
somebody.
theft or, yeah. I can look into that and find out, because that's a really good question. Okay. So if we compare the violent crime rates to our neighboring counties, Mason County has a little bit of a higher rate, but if we compare ourselves to the state, we're doing good. So the last thing I wanted to mention, this was not included in our overall ranking by any means, but I thought it was relevant for this board today based on the talk of syringe exchange. So the current rate of deaths due to drug overdose is 20 in Mason County per 100,000, and if we compare those to Grays Harbor County, we're lower, and Grays is one of the ones who've implemented a syringe exchange in order to try and alleviate this number. But we're still performing, or we're still have a higher rate than Lewis County in the state. So it definitely shows there's a need for that here in our county. So to summarize everything, through the health rankings, we're able to see that Mason County has some strengths in premature death, preventable hospital stays, and violent crime rate. I would also include graduation rate as a strength, with the caveat that although the rate has been improving over time, we're still performing below our comparable counties and the state in that measure. Lastly, it has also helped to identify some challenges. So here we see obesity prevalence is still a problem, STI infections, as well as children living in poverty. So if you have any questions, I'll take them now.
Allison?
Yes.
If you were going to direct us towards one area, you think we could move the needle in the next 12, 24 months?
Lydia, what do you
That's a
think?
great question.
That is a great
Which-
question.
Yeah. What would that be?
I'm going to look to my boss on that one. What do you think, Lydia?
All of the ones we're looking at, well, look, you have to go where the money goes. So I'd say the substance abuse and mental health are the two areas that we're going to be able to move and concentrate, because that's where the money's coming down to operate in. And we can move the needle.
Sure.
Yeah. No question, I think we can.
Well, we've already presented.
Yes, there's already been things that have been happening in the last 2 years that have changed. I wanted to give you the definition for violent crime.
Oh, yeah, there you go.
Violent crimes are defined as offenses that involve face-to-face confrontation between the victim and the perpetrator, including homicide, rape, robbery, and aggravated assault. So that's what they were measuring there.
Heavy stuff.
So I just wanted to also make a point. I mean, we talk about children in poverty, and I think that might be somewhat related to the opioid, whatnot.
Yes.
But also, just there is another data point for this county that I think is astonishingly scary, that our workforce participation rate, which means the percentage of the people who fall within the normal ages where you're in the workforce, is 45%. Your targets tend to be for good employment, tend to be in 55 to 60, and in some of your bigger markets, 65%. And if you talk to a lot of business owners, and even the hospital, and even the county, there's a lot of jobs we can't fill. And it's not that we don't have the people to do it, they're just not in the workforce. What is that? And then you go into opioid use or whatever else. But I think that that's another data point we really ought to be looking at.
That's why I was a little bit, and I agree, I'm wondering what causes, our unemployment rate in October was 5.4. This is going off of a January mark of 75 is the last one that we're showing here.
Yeah.
What happened in just that short term? Because, yeah, but
You have a lot of.
Christmas is
Christmas, yeah.
Seasonal employment.
Seasonal employment,
Mhm.
especially.
except for it to show in January, that would be, I don't know, could be. But that's a big jump.
Yeah,
But
it is.
it's pretty typical of a lot of areas to have a big jump in January. Seasonal employment.
Thank you, Allison. Anything else, any other questions for Allison before we move on?
Good job.
Thank you.
Yeah, good work.
Sorry, I was
If you
quick.
notice in your packet, we have a Public Health Week proclamation. Would somebody like to make a motion to support that?
I make a motion, we support the proclamation 2018 National Public Health Week and Mason County Public Health Month.
Thank you. Is there a second?
I'll second that.
Thank you. All in favor of supporting the proclamation, signify by saying aye.
Aye.
Opposed? Thank you. Passed. Any other business or board discussion at this point in time? Okay. Thank you. Is there a motion for adjournment?
I move we adjourn.
I'll second.
You got any public comment?
Nope, we left.
Oh.
They're commented earlier.
Thanks for keeping me honest. Appreciate it. Have a good evening. Thank you.
Thank you.
Thank you, Scott.